Gives me great pleasure to welcome back Julie Brewer, President, Care and Connectivity Solutions from Baxter. And you've been hearing Julie off and on throughout the summit, and you've been meeting her, and she's been sitting here and listening to everything that you've been saying. So thank you for doing that, Julie. And of course, I would love to invite Reaz Rasul, Executive Vice President and Group President, Healthcare Systems and Technologies, Baxter. Reaz is joining us today. And Reaz, thank you so much for your time this morning. So I'll be here with you.
Do you want this side or?
No, I'm fine
You're
here,
good?
yes, yes. So I'll be here this morning facilitating this Q&A. Please find your phones, the QR codes is there, and let's get some questions filtered to Reaz and Julie. Please take your seats. Okay, so we are waiting for the pigeonhole questions to settle. Wow, we already have a couple of questions here. So the first question that we have on our screen here is, what value do you see in industry-hospital partnerships?
Maybe I'll kick it off. So thanks again, everyone, for such an engaging couple of days. It's been a great education for me, and I know my team, and hopefully been great networking in the room here, and new friendships, new connections, because I really think this is what it's all about. I mean, we talk about, obviously, Baxter as a vendor, and we appreciate your trust in that relationship, but we strive really to be a solutions partner, to be a trusted advisor, to be the people that you come to work with to solve problems, and make sure that we use the experience from all the different touch points that we have across the globe, frankly, but certainly across the U.S. to collaborate with you. So this is one of the forums we want to do that in, but we want to make that just the way we engage, and hopefully you experience that today with those that are in your local area. Because as Patrick just said, I mean, we rely on these relationships and the communication and the proactive engagement to make sure we innovate in the most successful way. So I don't know if you'd add anything, Reaz.
No, I think that's exactly right. I mean, we have so many different ways to be able to partner with all of you, and we have taken different approaches. So some of you in the room, we have had more commercial-oriented partnerships. Others, we've done more innovation-oriented partnerships. And I think for us, as we take a step back and look at it as Baxter, where we need your help is to understand better what are the ways, given where you're at in your journey, that we can interlock with you. Because I think for everybody it's going to be a little bit different, and we have found over the years, as you would expect, one size will never fit all, and it shouldn't, frankly. And so for us, I think it's as much about getting the feedback from you so that we're with you exactly in the right stage in your journey. So
That's amazing. Thank you, Julie and Reaz. That's how partnerships work, I guess, right?
Absolutely.
How does Baxter's Care and Connectivity Solutions ensure that technology doesn't replace the human aspect of care, but rather enhances it? I think we've heard a little bit on this theme yesterday and today, but
I'll maybe comment of, and I've been learning a lot as we've been listening to the talk this morning with the AI discussion, as well as just how technology, and one of the takeaways, someone asked what the biggest takeaway was too, is that you can't obviously just plop technology in a hospital without spending the time to make sure we work together to re-engineer the process and what needs to change for the technology to be successful. And I think ultimately the technology is meant to support, to make that human connection and that nurses and caregivers role much more successful and less less fatigue around the alarms, or less fatigue around, more efficient in how they engage and make sure they're able to operate at the top of their license. So my view is that technology is there as an assistant, not as a replacement, and that's certainly the way I see it.
Yeah, I'm with you 100%, and I would also, to supplement what you're saying, I'd use the word it's an enabler. The reality is you are the ones who are on the front line delivering care. We are with you in the journey, but we are absolutely an enabler to support you. One of the things I've also found on the technology front is we have evolved over time, I think, as an industry in general, to ensure that we're bringing more applicable technologies for you. So that's technologies that are actually solving problems that you have, whether they're clinical oriented or whether they're operational problems. And so a lot of what we think about as we are developing technologies, not only in care and connectivity solutions, but across healthcare systems and technologies across Baxter, is we take a step back to understand what problem are we supporting you to solve. And is it one that is going to bring a different clinical outcome? Is it one that's going to bring more operational efficiency, and so on and so forth? So I think that having that as a lens to begin with, that allows us to make sure we have the right technologies as an enablement, again, because at the end of it all, you're delivering care hands-on.
Wonderful. So I just want to remind everybody that this is a LinkedIn Live session, so some of the questions are coming from LinkedIn as well to us. So please find your phones, take the QR codes, and ask the leaders away. The next question we have here is, where does Baxter see AI integrating with their technology to improve clinical workflows? You know, I think the theme sort of is technology and AI, so maybe we'll start with Reaz this time.
No problem. So I think AI has been quite pervasive in our industry, and it's coming rapidly. If you take a step back and look, AI has been around in many other industries for quite a long time. There's a lot of good lessons learned. So for us, I can maybe look at it in two different facets. First, we are utilizing AI today as we think about how we're developing our own products. So how are we able to generate code faster for our software products? How are we doing testing and doing different scenario planning with our products so that we are able to simulate different clinical conditions, different operational conditions? So we have a lot of different AI technologies that we are incorporating in terms of how we develop products. When we take a look at our products more specifically, we do a lot in terms of algorithm development and moving later into the stage of having more machine learning and AI inside the products is all in the roadmap. The second part of that is when you think about how AI is impacting care, when we have opportunities, I think, to partner with all of you to support, as an example, having a reduction in medication delivery errors. So when you're programming in something into a pump, how do you get to a place where you have enough information where it will pop up on your screen, an opportunity to tell you that, hey, are you sure this is the right level of medication that you want to give, given the parameters of this particular patient and this particular condition? So we have opportunities to continue to do more with you, and I think that will have a dramatic impact on care, and it will help not only medication safety, patient safety, but it'll also help on the operational efficiency side.
Yeah, no, I would just augment that with, and we've talked about a lot over the last couple of days, is how we truly get to more predictive and being able to give that nurse or caregiver a heads up before the event actually occurs, to improve patient outcomes, to improve nursing efficiency, to leverage all that data that we have and put it to good use. So I think, again, we've got a robust roadmap in this area, and even within the Baxter walls, we've got our own Baxi chat now that the employees can use and help to help to improve their own efficiency. And so how we take that and make it applicable to our customers is also a big area of focus. But would love your ideas and collaboration there as well.
Absolutely.
Wonderful. Thank you. Thank you. What are the division's key focus areas for innovation over the next 2-3 years, particularly regarding patient connectivity and real-time data management?
So I can start this off here and then hand it to you, Julie. So when we think about innovation in general, I'll take one step back first. Innovation for us is the lifeblood for our company. We have to continue to innovate, which is why what you've heard about today in terms of how we're looking to advance in the connected care arena with what Patrick shared, and I'm sure there have been several other discussions around it as well. We take a step back and we think about what problem are we actually solving. The biggest thing that we have to do up front, and Patrick showed it on one of his slides, is partner with you to understand, are we solving for a clinical outcome or are we solving for an operational outcome? And what specifically is the benefit that you will receive from that particular kind of innovation. So that's how we think about innovation more broadly. When we start to look at innovation by our different divisions, we are continuing to pursue innovation roadmaps in our cardiology portfolio. As an example, we're looking at having much more in the ambulatory cardiac monitoring space. So we will have a product in mobile cardiac telemetry that will come in the next generation. We have different focal points across all of our different divisions, but what I can assure you is that we heavily invest in our innovation and our research and development, and you always use the lens of what problem are we solving for you. One other piece to mention to that, in the connected care arena, and I think that was part of the question, is what are we thinking about there? We are looking at ensuring that the solutions that we develop all have a foundation and a basis. A lot of what we hear from many of our partners around the world is that the complexity level of what all of you face related to data management, connectivity, all of those things. We have an opportunity to simplify there. So we have an opportunity to have more singular, unified platforms as we think about innovation. We have an opportunity to ensure that all of our gateways have direct connectivity to all of our products. And those are all the kinds of things that we have had in our roadmap and we're continuing to execute on. All of this to bring a different level of simplicity to connectivity and data management for the ecosystem that all of us as a collective live in today.
Yeah, no, I agree. And I think, we're going to continue the focus, and we're passionate about, the technology that can help to reduce patient falls, improve that sort of ecosystem in the med-surg and the ICU, continuing to focus on best-in-class technologies there, continuing the passionate focus around pressure injury reduction. And as Reaz just said, how we bring all of these technologies together and leverage the data in a way that brings efficiency, and whether it's a Baxter technology or a third-party technology, really helping to clear the noise and bring that information together in a more simplified way is certainly an area of focus too. So we'll have both a software innovation focus as well as a hardware focus moving forward, but all towards the end of the problems that we're looking to solve based on your feedback.
Thank you, Julie. The next question I have on my screen here is, how can industries support standardization or minimum levels of technology in systems across the nation to best support optimal patient outcomes, reliability of best practices, and optimal work environment? Wow, that's a long question.
That's a great question. I would love it. I mean, we could get some roundtables going on that. I mean, maybe what I would say is one of my passion areas of focus, and Rami's going to love to hear this because it was said in the presentation on pressure injuries yesterday. We need to focus on more evidence. I think evidence is, we know that there's an impact around how we can improve outcomes, improve efficiencies. Together, we need to continue to demonstrate the impact. It will help as you all are building your business cases and looking at your own trade-offs in your facilities around what projects you're able to do. And it will also help as we drive standardization and policy and quality metrics nationally. So I'm super passionate about making sure we invest more and partner more around evidence and making sure that we have these types of forums to disseminate evidence, to talk about the evidence, to understand what the gaps are and what we should be doing next.
Absolutely. So
Anyway.
I can just add to that, maybe give a pitch here. Anybody who would love to partner with us on evidence, please reach out to me. You probably have my email address. You've been communicating with me throughout the planning of the summit. So we would love to partner with you to gather more evidence around our products and how they're improving outcomes and efficiencies in your centers. Reaz, do you have anything to add to that?
Let me add a piece. I think your point on evidence is exactly right. The more proof points we have, you can overall continue to elevate the minimum standard that we should all expect to see. The piece that I would share with you around general standardization, there's a lot of industry forums that exist today. AdvaMed would be a good example where we as a collective in industry will meet and look at data standards. How do we ensure that we are all utilizing the same data standards to make it easier for all of our partners, so that as you live in the very connected ecosystem, that we can have more interoperability in general, right? So there are pieces like that that are happening in parallel to a lot of these kinds of conversations that allow for more standardization as we're going forward as an industry.
Wow, thank you. Seems like the theme of AI is coming back here again. It's like, how does Baxter see AI integrating with their technology to improve clinical workflows?
Yeah, I think we talked about that a little bit already relative
so.
to, again, automating tasks that can be automated, giving the nursing staff and the caregivers more heads up ahead of time, predictive. There's a ton of opportunity there. So I think we've talked about that a lot over the last couple of days. If there's specific ideas that you guys have that we should be partnering together. The one thing I'll say about AI, we won't do it alone, right?
Yeah.
We need data partnership with customers. We work with the Microsofts of the world, so it's a triangle here of collaboration to truly get where we want to go there. And again, a lot on the roadmap, but more to do.
Awesome. So obviously now we're getting the questions which have more votes here on Pigeonhole. Do you predict the cost of technology advancement to increase, decrease, or stay the same in the future? And why do you think so?
So that's a good question. I think, again, I'll take it back to more about the value and the outcome and how we prove the value and the outcome in the business cases around the technology and what it's doing to improve care or improve efficiencies. So I think overall, I don't know that I can answer whether it's going to go up or down or stay the same. I think in the general, it needs to provide, the value needs to increase, the outcomes need to improve, and the business cases need to be stronger.
Stronger.
Exactly.
Reaz, anything
No, I
to add?
think that's exactly right. And as we're seeing that there are more fiscal constraints that we see all over the world, we know that what Julie just said is absolutely true. The value that people are receiving from the technology advancement has to go up. It has to be significantly higher because the business case and the equation, frankly, doesn't work out otherwise. And I think all of us who are sitting on this side at Baxter are very, very well aware of that. So as we think about our innovation roadmaps, our technology roadmaps, our focus is very much on what is the actual clinical value add or operational value add, so that we can have a very different conversation with you in terms of what that particular solution or offering will actually do to impact you positively.
Awesome. So how do we as health system leaders, I think this is a question from the audience here, with innovative ideas connect with your teams?
So I would love feedback on this because I'm so excited that we're here, number one. So we're going to commit to doing these. Ideally, I'd like to see us do them a couple times a year in these sort of sessions. But then also, as Patrick said, we are very much focused externally to say, how do we incorporate those that are interested in some of our agile development programs? I would say working with your local teams to express your interest, and then we can continue to work around putting consortiums together around certain projects. Virtual connections. I know I meet with some of you already, a few times a year. But I think we just need to be deliberate, and we need to understand the interest, and we will absolutely make it happen and put a cadence in place of connection, whether that's monthly, quarterly, a couple times a year. So please just raise your hand because we're super excited to engage, and then we can formalize operating mechanisms around what it looks like, right? Do we want to create a work team around a certain problem that we're looking to solve together? Do we want to, put together someone from Rummy's team to talk about evidence? So I'd say it can look differently based on what it is, but we're committed to having the conversation.
Anything to add to that, Reaz?
The only piece I would mention there is, I think, advisory boards. We do different advisory boards across our business for product areas or clinical problems that we are looking to solve with you. And so getting your participation in those would be extremely impactful for us. So we're very, very open to it.
I think we've sort of answered the next question here. What do you look for a clinical partner for innovation?
Patrick, I thought, did a great job of giving some, insight into how we look at it internally. But I would love those that are willing to be a learning laboratory with us. I mean, we need to be able to be in a live environment and do some early releases and some iterative development together to make sure we get it right. And so some places have the stomach for that and some places don't. So I think, it's a matter of whether or not that's an endeavor that your teams are interested in, motivated and inspired to be part of those sort of early innovation learning laboratories. So that's the way I would describe it.
She answered it perfectly.
She did, yeah.
I mean, great job.
I'm just doing a kind of quick sidebar. So
Yeah, there you go.
Another.
We talked a little bit
we
about
talked
this one
about
already.
this question.
already,
I think
yeah.
we've already answered this one, team.
There was a question about the biggest takeaway from this session.
I was going to come to that at the very end.
Okay, I'll hold then. I'll hold.
How do you keep your teams connected to their impact on clinician experience and ultimately patient outcomes? Their work is so meaningful and it may be hard to connect to that from afar.
I think there are many ways that we stay connected with you. We have a very, very large service organization, and we have folks who are in with you in your hospitals and care facilities on a daily basis, and we get a lot of feedback and input from them as we think about our development and how we can make our portfolio better, how we make our solutions better. Also, when I think about some of the folks who are actually developing our product, we are working with different partners, many of you, on having folks come in and do more observational research and spending time up front with you to understand the problems that you're looking at today, how can we help you to solve them. But it is really about us being with you side by side and getting on the ground. Because one of the things that I believe for us is going to be fundamental as we think about our innovation is if we're not innovating hand in hand with you and actually seeing the problems live, going back and innovating in a lab, those days have kind of passed. And so it is absolutely critical that we do that. And I think we're doing more and more of that. So we have more engineers who are out in the field with you. We have our service folks. We have our marketing people. And in fact, Julie and myself spend a fair amount of time with many of our customers and partners just for that same reason, to learn and be connected and understand how you're delivering care and what you see on a daily basis.
Awesome. So I'm going to ask the question on our left here, because it could be different for the two of you here. What specific Baxter product or software are you most proud of and excited about in regards to improving patient outcomes?
This is like choosing your favorite child, isn't it, kind of? I mean, that's not, so I'm going to, any of my team that's sitting in the back of the room, I love you all. Yeah. And I love all your technologies. It's good. But I would say, I'm really excited about what I've heard about the impact of the patient safety and what you've done in Colorado, Becky, with the Falls Initiative, and what the Stanford team has done with connecting those technologies in a way that's truly leading to outcomes. So I'm really excited to see those solutions come together and the impact that you're having. So that, gives my heart happiness. But we've got a lot of other wonderful children as well that deserve their time in the spotlight. But
Yes.
So
what would you say?
Which
Product?
Yeah, which product or solution are you most proud of? Your favorite child?
I'll pick a product. I will tell you, I've been very impressed with Progressive Plus. We have a lot of different products in our portfolio, but when I think about the advancements that we're bringing with that, I'm really, really excited about that one in particular. And given the different programs that we're running around, the fall, all of those things, it's very, very exciting for me.
Maybe on the connected monitoring side for Welch Allen too, the impact of when you connect those monitors in the hospital and getting away from nurses putting all their stats on a sticky note or on their hand and connecting that directly into the EHR. Are you guys having connectivity with your? Hopefully you're doing that already. If you're not, please connect your Welch Allen monitors. It'll have a huge impact on your nursing efficiency.
Do you see Baxter's technology helping outside hospital walls and into patients' day-to-day lives to aid in the health of patient continuum?
Absolutely, and we have several solutions today. If I just highlight one for us in the ambulatory cardiac monitoring space, we actually have patches that people are wearing outside of the hospital in their home lives to measure arrhythmias and cardiac functionality, and that product in particular is one that's already existing today, and we have more that are coming in that space. In fact, I believe yesterday or today we just launched our new Vest APX, And it is
Yes.
a high frequency oscillation vest that people with respiratory challenges would wear. So we have a lot that's coming
That's
outside
new.
of the hospital, and that's outside of the acute space. So
I'd love to learn more from those in the audience, though, of what you're doing with hospital to home. I mean, obviously, we're focusing a lot right now around efficiencies within the four walls of the hospital. We have a ton of our frontline care technology in the outpatient
That's right.
facilities with
That's
primary
right.
care and in patient homes with our respiratory division. Obviously, we're selling our kidney division, which was obviously very home-focused. But there's, I think, a lot more to learn and do around hospital to home, so that maybe that's a topic for the next summit.
Yeah,
Rani.
absolutely, absolutely. I mean, out-of-hospital care is becoming very big.
Yeah.
Well, and I think for us, we are a very large participant in the primary care arena. We have a lot of physical assessment products, diagnostic products that are all there. And that is going to continue to be a big focus area for us in parallel with what we're doing in the acute space.
Absolutely. How is research and development prioritized at Baxter?
So we're in the middle of our annual planning phase right now, so please tell Reaz that he should allocate as many of the funds to minor skin.
Yes.
So we are in I'm sure you all go through this too, right? We're all negotiating for our business cases for our best investments. But in all seriousness, it's a process that is pretty robust, right? Where we're doing a sort of a rack and stack of all the opportunities out there. And as Patrick said, he stole my line and I stole it from somebody else. We can do anything, but we can't do everything. So going through, it's the number one area of investment that we focus on, right? It is the lifeblood of what we do, and it is the lifeblood of the future. And so making sure we place the right bets, because we can't do it all based upon, just as you all have limited budgets, we can't do it all. So we have to place the right bets, and that's what really relies on the feedback from all of you to make sure we pick the right bets to move forward with.
Absolutely. And I think for us, it comes down to where can we be most impactful with all of our partners. We have a lot of different solutions today, and so we do focus some of our investments on ensuring continuity of those solutions, as everybody would. But when we think about the new innovations, it comes back to the feedback, as Julie mentioned, that we hear from all of you, and then understanding how we translate that into something that will be most impactful. And the impact level that we can have with our partners is a significant area that we focus on from a prioritization perspective for the innovation that we look to fund and then bring into the marketplace.
So I know we started a little early, but maybe we can just take a couple of more questions if
Sure.
you don't
Yeah,
mind.
yeah, sure.
Okay, how is Baxter directly incorporating the patient experience into technology innovations and or improvement? I think Patrick touched upon it a bit, but I would like to hear your take as well on that.
Sure, I'll start. I mean, so first of all, I think this is a work in progress, I would call it, for our teams, and certainly part of the design thinking process that Patrick just described earlier. We have a great relationship with the OneView technology that you probably saw at the Technology Summit. We're really excited about that patient experience solution, and we're going to be continuing to work towards making that best in class as well. I think that, clearly as we look at the technologies that we have today, both from a sustaining and from a new technology perspective, understanding the feedback from patients and really evaluating what needs to improve or iterate the technology is a continuous process. Make everything from the surfaces we have on the beds and what the patient experiences with those technologies to again, how we can engage and make that experience in the room as in a difficult time as positive as possible.
Yeah. I also would add there that when we think about patient experience, it comes down to the details. Do you have a charger plug available in whatever you're utilizing? Mm-hmm. Whether it's you're laying on a bed or you have other opportunities. So for us, we are thinking about that from that perspective. A lot of the feedback that we get around patient experience, though, does come from clinicians. And to Julie's point, when we think about it as a work in progress, in some of the areas where we have more direct patient touch, as an example, the vest I talked about in respiratory health that we just launched yesterday, we get a lot of direct patient feedback there around comfort and what are the right attributes we need to have to ensure that for a direct patient experience, it's an optimal experience. So I think we've got more to do there. In some areas where it's more direct to patients, we do a lot there, and then the other areas which are more acute oriented, we get a lot of feedback from all of you.
Yeah, I think we are involved in a lot of ethnographic research.
Yes.
That's the word of the day now, right?
That's the word of the day, ethnographic research.
I don't know if I can spell that, though. Can
I don't know whether what Patrick was saying, ethnology is the word, but ethnographic research definitely is.
There you go.
Patrick. So Sean would love to know, how is Baxter connecting the admin portals of various systems like Nurse Call, Volt, Welch Allen Connix device to reduce the administrative efforts of provisioning users separately on each system?
So what you're saying is it's not working perfectly today, Sean, but I know, I think that there's, we hear you. And so, yes, a tremendous amount of work and focus around sort of how we're leveraging unified directories and modernizing the architecture to do the appropriate containerization to leverage, as well as what, Reaz, I'll have you talk to the device bridge technology of how we're looking to leverage one pipe moving forward as well.
Yeah, I would tell you, I think Device Bridge will go a long way in enabling this. I mean, we need to get to a place where we have a single sign-on, as an example, right? So you're not logging into all the multiple systems every time. And so the roadmaps that we have and the investments that we're making are all in those kinds of areas. So how do we simplify the connectivity experience? How do we simplify the user engagement experience as well? So step one becomes make sure you can connect seamlessly into one integrated platform that is embedded in the data ecosystem of your particular hospital. Step two then from there becomes how do we ensure that we have a level of interoperability that reduces the sign-ins, that reduces the multiple logins for different systems, all of these other things. And then step three is how do you connect all of that together into a visualization capability where you're able to get the information that you want so that you're not floating through the sea of data trying to figure out relevancy, right? So I think we have an opportunity there as well to partner with you to make sure that we get that right in terms of full visualization. So that's kind of how I would walk that part of the path there.
Maybe I'll add to that too. You didn't ask this in your question, Sean, but I'm looking at Heather at HCA because I know she'll appreciate this. We definitely, as we look to continue to modernize, how we reduce this, so the upgrade times and the lift that we have out there with the facilities to make it more seamless and less of a lift for your teams. We're going to continue to work towards, modernizing the technology in a way that allows for simpler upgrades in the field. So I know that's a goal in many of our sites, and it's certainly a goal of ours as well.
Awesome. So maybe one last question.
Sure.
My facility doesn't have Baxter ConnectEd Care call system at this time, but does own many Baxter Hill-Round devices beds. Is there a way to capture continuous monitoring reports without complete integration?
So we have there are pieces of the technology that will connect regardless of your nurse call system. It won't be quite as robust as if it's an integrated Baxter system with our Baxter beds, but we do have the data components that we'll still send.
And I think,
go ahead specifically.
I was going to say Device Bridge probably will also solve some of that.
We'll help for that, and I think it becomes case by case based on which products you have. So I think that was Yvette who had asked the question.
Yes.
So Yvette, if you could
Where are
share,
you,
if you're
Yvette?
here somewhere, we can make sure we have the right person who is here on the Baxter side. You're over here. Okay. So we can have somebody come and have a more detailed discussion with you around that. As if you can share areas of the portfolio that you have, we can share with you what's available.
Awesome. So my last question probably is going to be directed to Julie more than Reaz, because Julie has been here. Sorry, Reaz, I know you.
No,
you couldn't prioritize to be everywhere, of course. Julie, what has been some of the key takeaways from the summit for you?
So the key takeaways for me are, first of all, we need to do more of these because I'm super energized by the engagement and the connection that everyone's making and the feedback and the learning that we're all having together. So that's my first takeaway, is we need to do more of them. The second takeaway is I really want to work with my team and talk about how we can really improve the way we're implementing and collaborating and deploying technology with you, so that we can help with that change management and make sure that the technology is having the biggest impact. I heard a lot about re-engineering processes and workflow, and I don't know if we spend as much time as we should to really think through that with you as we're deploying technology. So I wanted to make sure we're doing best-in-class work there. And then I would say, having more opportunities to connect
and talk.
and to really engage in different technology, whether it's around evidence or some of our development projects. So I'm really enthusiastic about just the level of engagement. Everyone's still here in the room. I just think that's awesome, because usually it's half full by this time. And so thank you for being resilient and sticking with us to the end as well.
Anything from you, Reaz, to our audience?
So excited that we're doing this session. As Julie mentioned, this is the first of many that will be to follow. So appreciate all of your engagement, all of your input, and participation that we've had here. I've heard really great things. I had a chance to speak to a few of you in the hallway and heard great feedback about the ability to connect with your peers here, to understand best practices, and also to understand a bit more about how we are thinking about the evolution of this space in general. So very, very excited for the ones to come after this. And as you have suggestions for some of the things that we can cover and highlight in future sessions here, please feel free to share. So thank you again.
And thanks again to all the faculty.